In 2017, a study conducted by 2 professors from Daphne School of Nursing suggests that women live-in caregivers' precarious work and migration status cause immense mental health stress on them. Welcome to Season 2 of Mom Let's Talk, brought to you by Northern Community House, an organization that builds strong, resilient, and inclusive communities in Northwest Toronto. I'm Farhannah, your host. Today, we're continuing the story of Maria, a registered nurse who began working as a live-in caregiver in 2017. In this episode, we'll discuss how precarious work and migration status affected Maria's mental health. Due to the sensitivity of our topic, the names of our interviewees have been changed. With the hope of providing a better future for herself, her sister, and her single mom, Maria left her job in Dubai as an assistant nurse to move to Canada. Let's continue to listen to Maria's story.
For the immigration, I know that we have lots of challenges right now facing, like the pandemic and what happened in Afghanistan, what happened in Ukraine. But they have also to see what happened to those caregivers who's inside the Canada. What happened to their papers? That same as me, I'm waiting already for almost 5 years. And then what happened to me is I undergo depression because of that. Because like hindi naman natin gugustuhin na yung kababayan natin, yung ibang caregiver na hindi sila maging PR. Masaya tayo na makukuha din nila yun. Pero hindi tao lang din tayo na nasasaktan tayo na why? Bakit? Yung sa akin hindi pa. Na mas nauna pa ako sa kanya. Natapos ko yung 2 taon ko, kumpleto yung 24 months ko. Sobra pa nga. But why they open another pathway that caregiver, like they have only 1 year eligibility. So if you finish 1 year, you can already apply for PR. It's so unfair for us also. We want them. Who doesn't want to be a PR? But they have to fix that one also because it should be systematic. It should be who will finish. Will go for 24 months, they have to do that one first before they will jump to another solution. Because it's so hard for us. We are paying also. We are here working also at the same with the other caregivers. We suffered also. It should be fair for everyone. The whole month of March. So I cried. I don't know what to do. Like I'm walking in the street and then suddenly there's a car. So it's like, oh, what happened? Hindi ko talaga alam kung saan ako pupunta. Hindi ko alam kung anong mararamdaman ko. Halo-halo yung nararamdaman ko. Hindi ko na naisip kung tama pa ba to or ano pa ba to. Pero yung paano ko siya na-overcome, it's like I always pray. So I always pray na sana hindi ko naman ginusto na ma-depress ako. Walang tao na gustong ma-depress. Pero nangyayari lang talaga yun sa yung challenge na hindi mo na talaga kayang bitbitin. Yung alam mo yung actually na-overcome ko siya kasi yung mga kaibigan ko nagsasabi na ito, part lang yan. Lahat naman talaga dadanas dyan. Sooner or later in God's time, it will be granted. But I'm always thinking also, like you, Ella, I'm so thankful because that time when you call me, it's like an answered prayer that you said, oh, mas maigi ka pa kasi natapos ka na, you're just only waiting. So you are more lucky than them because them, hindi pa sila natapos. So you're just only waiting. You have only to pray and ask always, sooner or later, it will be granted. So kailangan lang talaga i-lift yung sarili kasi wala namang tutulong sa'yo. Kahit yung mga friends mo nakakatulong sila. Pero kung hindi mo din kaya tulungan yung sarili mo, wala ding mangyayari sa'yo. Malulugmok at malulugmok ka talaga.
Thank you for sharing your story with us, Maria. And joining us today is Ella Tan, the Employment and Family Support Worker for Filipino women at North York Community House. Hi, Ella. It's so nice to have you back.
Hi, Farhannah. Thanks for having me.
So in the last 2 episodes, we talked about the precarious working conditions Maria faced with her first employer. She was also overworked since she had to take 3 jobs to continue supporting herself and send money home. Today, we heard that Maria had to deal with mental health challenges as well. Ella, Maria mentioned that she was having issues with her immigration papers. What seems to be the problem?
So, Farhannah, when you try to look at it, Maria's paper has been delayed for almost 5 years, right? And now she's still waiting for the results of her application. There are many reasons why there could be an immigration process delay. Probably there could be missing information or any supporting document, which leads to a delay. And also COVID-19 pandemic causes serious backlog in the process. In addition to the pandemic, there is also a situation in Afghanistan and the war in Ukraine. All these factors definitely creates a lot of stress for caregivers who are waiting for their application to be processed. So in Maria's case, the delay has negatively impacted her earning potentials and career advancement. She's in a state of limbo, not knowing when things would change, and she's also the breadwinner of her family, right? And as she mentioned, she's currently supporting her single mother to raise her sister so that she can finish university. So there's so much uncertainty, and that create a lot of pressure and stress, and that affects her mental health.
Mm-hmm. I mean, 5 years of uncertainty is definitely anxiety-inducing. So based on your years of experience working with caregivers, what other factors can contribute to challenges with mental health?
Well, financial constraints are a big issue here. So not having a support system, also feeling sense of powerlessness and anxiety about family back home, and especially if there is an emergency like illness, death, or other issues. Precarious work and also being under surveillance at work, where employers can be quite controlling sometimes.
Mm-hmm. Which are things that I think we mentioned in our previous episodes. One thing that I noticed when Maria talked about feeling depressed is that she didn't mention seeking any mental health services or professional help. Do you happen to know why, or based on your experience, why might it be the case?
Well, there could be several reasons why she did not access services for her mental health issues. As we know, there's a stigma around mental health, right? And seeing a psychologist or psychiatrist could be a sign of weakness as well in our Filipino culture. So that's one thing. In addition, there's also limited resources of services in terms of, seeking for Tagalog-speaking counselor. Unfortunately, for some caregivers, the lack of Tagalog-speaking counselor makes it difficult for them to fully express themselves. Like, for example, you're having problem, you're emotionally stressed out, and you want to express that in a way that someone could understand you. So you want to talk about your problem in your own language, right? And this is something that they feel like important for them. As we've said, language barrier, like if you're talking to native English language speaker and, you're having trouble expressing yourself. So there's it can be problematic. Sometimes it can be translated into different things, and then, you get a different advice from a psychologist that you feel not comfortable. So those are the things that, wanting them to access a Tagalog-speaking worker, which is in Toronto, there's really scarce in terms of Tagalog speaker counselor. Also, we know that counseling can be very expensive. It could take 90 to 150 per hour. And given that they are in this financial situation, I don't think they are able to afford getting a counselor for their mental health issues. Finally, Filipinos rely more on talking with friends or family. Not to mention that Filipinos are predominantly Catholic, so they rely so much on prayers, But then again, if you're a newcomer, new to Canada, less resources and less access to network of friends because you're staying with your family member. So those are the things that does not allow them to access the services that they need.
It sounds like there's a lot of barriers. However, for live-in caregivers who are possibly experiencing extreme stress and anxiety, how can niche support them?
Well, we can definitely provide them supportive counseling. North York Community House has been providing information and referral to clients. But one thing that, some people don't know that, to come to our office and afforded with a settlement counselor who can listen to your situation. And then this involve having one-on-one session with caregiver, and that they can express their concern and receive support and understanding and knowledge on how to resolve their issues. This can help lessen their anxiety as they have someone who can listen to them, which is a very important part of resolving some of the issues that they're carrying with. For example, when Maria came to me and we work on creating short-term goals to help her with her long-term goals. So I remember when she mentioned about she was really focused on getting her immigration documents and status as permanent residency, but it's not happening, and that's giving her so much stress. So we kind of like work on the things that what she can do now rather than think about something that not achievable today. So this is something that, she realized that there is more to do rather than kept thinking about, something that she can do, and that gives entertaining those negative thoughts like what if I'm not going to be permanent resident? What if they're not going to give me the status? So those are the things that we can work with a caregiver or any caregiver that similar situation with Maria. And also we've started working with creating with her resume and suggesting to look for a volunteering position so that she can build her Canadian experience. So rather than focusing on something that's not happening today, we try to help her focus on the things that she can do while waiting for her immigration status. And that really gave her some sort of relief that, about her situation. So we can also provide information to help them access a family doctor that can provide referral for a psychological or psychiatric help that is covered by OHIP. So there are certain processes in terms of accessing mental health resources. It's not just like, a settlement worker would send her to a psychiatrist. It has to be the family doctor. When the family doctor diagnoses that she really has this mental health issue based on, their tools that are available for them, then they are the only person who can refer them for psychological and psychiatric help. And that is covered by OHIP.
So Ella, it's great that you were able to work with Maria and offer her support so that she could focus on things that she could control. And also it's valuable to know that there are services available for caregivers in case they need it, such as support from North York Community House, and they can also seek help from their family doctors. As always, thank you so much for joining us, Ella. For live-in caregivers who might be needing support, how can they contact you?
They can reach me through my email, etan@nych.ca, or they can give me a call at 416-636-2600, extension 4228.
Again, it was a pleasure to have you today, Ella, and special thanks to Maria for sharing your story with us. Next on Mom Let's Talk, we'll discuss the steps Maria is taking to become a permanent resident and a registered nurse in Canada. Thank you for listening. Hanggang sa susunod! This podcast is brought to you by North York Community House. North York Community House builds strong, resilient, and inclusive communities in Northwest Toronto. We help children, youth, parents, and seniors become active, engaged citizens who lead positive change in their neighborhoods. Find us at nych.ca.